Okay, so I think we're gonna kick off. Good afternoon, everyone. My name is Caitlin Redden. I'm a regional consultant with TriNet Life Sciences, and joined by me today is my colleague Casey Kaltenbach, and we are also very excitedly joined by John Kouten, CEO of JFK Communications. Before we start, I wanted to just share a little bit about TriNet and JFK Communications for those who may not be familiar. So a little bit about JFK Communications. JFK Communications, Inc. was founded in 2004 to provide innovative marketing and communication services to science-oriented companies, healthcare organizations, and nonprofit groups. JFK's principal, John F. Kouten, has fostered a corporate culture at JFK which focuses on superior client services, creative programming, and measurable results. To learn more about JFK Communications, please visit jfkhealth.com. A little bit about TriNet. So TriNet is a professional employer organization that provides small and medium-sized companies with full-service HR solutions tailored by industry. TriNet helps companies grow their business, improve operational efficiencies, and attract and retain top talent in order to free small businesses from HR complexities. TriNet offers access to human capital expertise, benefits, risk mitigation, and compliance, payroll, and real-time technology. Just some housekeeping rules. If you have any questions during the course of the presentation, please type them into the chat box. We will be monitoring it throughout, and we'll be sure to answer them at the end of the presentation. Once the presentation is over, we will unmute, and you're also free to ask questions then. So at this time, I would like to introduce John Kouten, CEO of JFK Communications. John?
Thank you so much, Caitlin. Can you hear me?
Sure can.
Very good, very good. Thank you so much for that kind introduction, and thank you for the invitation to speak with the group today about this important topic, especially now. We'll be talking about strategic communication in life science as it relates to the COVID-19 pandemic. And I'll be talking for a while. I'll try to remain engaging, but please remember to post your questions in the chat box, and I look forward very much to engaging after I've had a chance to go through the material. And I'm going to cover the material in basically three separate buckets. I'd like to provide an overview of COVID-19 and the impact of this pandemic crisis. Considering the audience today and my background, I do want to provide a little bit of background on the impact of the pandemic on the life science industry. But please know that any presentation that's 20 slides long will leave things out. But the majority of my talk will focus on my area of expertise, which, as Caitlin said, is strategic communications and public relations. I've worked for 30 years and have experience working on the agency side in New York City at big agencies and inside of big pharma at companies like Bristol Myers Squibb and Johnson & Johnson, and with clients at my current firm, JFK Communications, which I've had for the last 16 years. So we'll talk about best practices for communicating in the midst of this horrific pandemic, strategic considerations for reopening, and also preparation for possible rebound and the necessary, communication activities around those aspects of the crisis. So I know that if you're in life science, we're probably fatigued. I know that I am, to talk about COVID-19. I know many of us would just as soon go to sleep and wake up in 2021 from confusion around the virus to confusion around testing to confusion about what it means to shelter in place, from the economic impact globally of this virus to the endless politicization of this virus. It really does impact all of us, not just in the life science industry. And me personally, I personally am suffering because organized professional sports is still, with the exception of the PGA, we're still waiting to get some distraction from all of this. So why is this? Where are we right now? I do want to take a minute and show you the charts that anybody can find these charts right on Google, and the information here. I can't really even say it's promising. We should take caution in anything as it relates to this virus. But as you can see, I think in the U.S. and on the global charts, we've seen peaks. It doesn't mean we won't see higher peaks, but from the beginning of the year, we have experienced a downturn. Now, this is unprecedented, and you know, the fact that people are interested in learning about crisis communications who are in the life science industry understand that if you're in life science, you will experience crises. And if we've been around the industry for any amount of time, we've experienced crises. I've been around long enough to have weathered my fair share, but nothing even remotely close to why COVID-19 is so unprecedented. And this is a short list, and as I said, you know, in the discussion period of this webinar, we can talk about other ways that this pandemic is unprecedented. But if you just look at the speed of it, it really came on fast, and we began to see reports in January and February, and looking at an arbitrary date, today is June 24th. If you look at March 24th, according to the CDC, there was about 550 deaths on March 24th. So if you fast forward less than 100 days, we're at 123,000 deaths just in the US. So the speed of this is unprecedented, and the scale of it is unprecedented, and the impact across the board is the likes of which I hope we never see again, but it is going to be with us. We were talking before that, you know, the discussion around what is going to be normal or back to normal probably is the wrong vocabulary, and it's probably going to be, you know, something more predictable as we move into a world where there's possibly a vaccine or herd immunity, if that even will happen. So we will be talking about all the aspects of how this pandemic is impacting not just ourselves, but more importantly, the industry that we are all working to serve, the life science industry. And again, I'm a professional communicator that works in the life science industry. So I will say, to the extent that I want to talk more about communication and strategic crisis communication, but here's some thoughts about how this pandemic has impacted the life science industry. This slide is interesting because it does show the resilience of the life science industry when we're talking about a life science crisis, or a crisis that could benefit from our expertise. Now, the one thing that I would say about this slide is I think that based on what I'm going to present next, we should not rest on our laurels because the NASDAQ Biotech Index or the Dow Jones Pharmaceutical Index looks good, and the MedTech 100 did take a dive, but is almost back to baseline. I think that the life science industry is going to be facing tough times ahead, and as life science leaders and people that are serving the life science industry, we should be preparing for that, despite what these indices show, and despite how good the IPO market may look right now for biotech, and despite how high flying some of these COVID stocks are. Let us take a look at some of the other headwinds and impact factors on the life science industry very quickly. You can't talk about it unless you talk about supply chain remains under intense pressure. Our life science industry relies heavily on markets where it's difficult to get supply chain, such as India and China. On a positive note, we are pivoting as an industry to support COVID with drugs and vaccines and other support. We're also getting support from the regulatory agencies with the FDA, providing some emergency use authorization policies to enable more rapid introduction of products to support COVID. From a workforce standpoint, we're almost 100% virtual. Medical congresses are discontinued, and I'll talk about that. The explosion of telemedicine, while a bellwether for that industry, and while that might be efficient, it is an impact on the medical community. There is a place for digital health, but we're seeing some declines in people going to the office, to doctors' offices and hospitals for a variety of reasons, whether it's fear of COVID infection, whether it's mobility impairment, or whether it's financial. The New York Times earlier this week published an article about the fact that people aren't going to the doctor anymore. So we are seeing that, and more recently, we did witness the announcement earlier this week by the American Cancer Society that they are laying off 1,000 people, which is 25% of their workforce. So patient advocacy, we will see taking a huge hit because of COVID. We also saw that the Kouten Breast Cancer Foundation announced that they'll be closing all their regional offices and moving to a more virtual model. So these are all signs of impact, and mostly negative. And we're seeing people not getting elective surgeries, hospitals laying folks off, specialists being seconded into GP, general practice, general medicine roles. My wife is an employee here in New Jersey at Hackensack Meridian, and we're seeing, and I'm seeing it firsthand, the exhaustion and the fatigue and the burnout among these frontline essential workers. Clinical trials significantly impacted, with the exception of some COVID-19 trials for treatments and vaccines, but for the most part, clinical trials are either stopped or on hold. Huge impact on the life science industry. The availability to sell has been hampered. If you look at baseline, we're 92% down in office visits by pharma reps from the beginning of the year. This is going to have significant impact on drug sales. Finally, this slide shows the impact on medical congresses, which are, until further notice, canceled for the most part. And I'd say, this survey data, if you look at when live meetings will return, how likely are you to return to traditional Congress scientific exchange platforms? And you've got nearly 15% saying unlikely, and over 5% saying very unlikely. That's pretty chilling. So over 20%, almost 25% of medical congresses may not resume. So the life science industry is going to have to pivot, moving forward. So here we are with in the midst of this pandemic, and JFK Communications has been working with its partner organizations for about 5 months on managing what to do, how to do it, when to do it, from the perspective of communication. And I'm going to talk about some best practices for managing the communication around the COVID-19 pandemic. And this slide provides us with kind of a snapshot of what constitutes a good crisis communication plan And this works whether it's COVID-19 or not, but setting a positive tone right from the outset is vital in any communication around any crisis. And for COVID-19, the best companies have been the ones that have been really setting a positive tone. We've been careful not to over-assure our audiences, but when we have a good leader taking control, it boils down to instilling confidence and trust in the individuals that rely on us, whether it's our employees or our customers. The other key component is speed. Some of the things that we've seen is delay. And rapid communication is very preferable in a crisis to silence. It is very acceptable for us to say, I don't know. And it's okay to say, I don't know often. It really does a lot for your customers to reduce fear and for your employees to reduce fear by making sure that you're showing the emotion of the crisis, that you're showing that you are working towards making sure that you're doing everything that you can do, which is honest. And one of the things that we cannot do in a crisis is to be disingenuous, to obfuscate, especially the truth. And a lot of our clients are in a crisis and they ask, when should we communicate? And the rule of thumb is always early and often. And don't hold bad news. It seems like we've been going full bore, always kind of announcing bad news, but if you have bad news about a trial closure or about a plant closure or about an R&D milestone that's missed, it is much better for you to get out in front of it than to have the rumor mill or an employee announce something on social media. And best practices for our CEO or someone from our C-suite to be the spokesperson for the company. And you should always have a backup as a best practice in case your CEO is indisposed. Listening, and this slide says take action, listen, and repeat. And listening is vital. My mother, she always said, John, you have 2 ears and 1 mouth, do the math. And so we must listen in order to hear what our constituents are saying about what we're doing. And we must, in order to pivot, we need to know what we're pivoting from and what we're pivoting to. And many times when we're listening to what our customers are saying or our employees or what the government or the media is saying, it enables us to redirect what we're doing with our crisis plan. And I emphasize the word plan. I'm going to be talking a lot about planning because this is not a time to do anything on the fly. It is not a time to shoot from the hip. It is not a time to go with your gut. We need to have good communication plans in place. When you have a plan, you can change your plan. So, I don't mean to make folks feel bad who don't have a crisis communication plan, but this is a good inflection point if that's the case to build one. And I'm happy to walk anybody through the process of that offline. So much of the conversation is turning to reopening, and reopening is important, and reopening is going to be vital for our business, vital for our customers, and most importantly for our industry, vital for patients. But we have to have a reopening plan, and this should be rolled up into our crisis plan and should be a tab within our crisis plan. It should include a reopening task force. Much of the members of that task force will be similar to the folks that are on the crisis task force. It should clearly adhere to any policies from a state perspective, from a federal or local perspective, and for our clients and for the folks that are on this call listening who are global, any country rules for reopening. One of the most important things that we also need to take into account is the employee. Some employees will still have fear about returning to work. We need to be extremely sensitive to the needs of the employee, especially their mental health and confidentiality. We've lost folks, and many of our clients and many of the life science industry have lost folks, and when reopening, we must be sensitive to honor them. Anything that we do in our reopening work should always be reviewed by a lawyer. There should be a legal component always to our crisis communication activities, especially something as sensitive as reopening during this pandemic, because much of the reopening will constitute a new way of living. And I mean that literally. There's going to be a new way of living in this country that will focus a lot on the workplace, whether it's an office or an R&D lab or a manufacturing facility. It needs to be adapted. There's going to be a lot of emphasis on cleanliness and sanitation, and it must comply. And our operations people, we've been at JFK Communications, we've been working tirelessly with these committees, a lot of CEOs, but we rely heavily on the regulatory and the operations people to feed us all of the regulations so that we can word them into language that's understandable to all of our constituent audiences, which for our industry run the gamut. And again, you can probably add to this list our commercial partners, our academic partners, our government partners, our clinical, investor, patient, and physician partners. We need to be sensitive to the messages that need to go to them to make them feel comfortable with our reopening plan. Looking at the reopening plan considerations, once we have our plan, we implement our plan and we're communicating, and I've encouraged us to utilize the same communication channels that we utilized when communicating about the pandemic, we need to utilize with our reopening plans. Don't forget about the media. Don't forget to poll your employees and your customers to find out how you did in communicating, where the gaps were, and fill those gaps in as you move forward in reopening so that you can fix anything maybe that you did wrong or where you fell short. And again, these plans are just the beginning. There's no replacement for hard work, and keeping our constituents and our audiences up to date with what's going on with our company as it relates to reopening in the midst of this pandemic, it just boils down to hard work. I mean, these guys are the guys that we work with, and the folks that have the responsibility of doing this communication work. They work hard, and it's long hours, but it's very vital and it's very important because, again, back to the beginning, when it's honest and it's consistent and it's positively toned, it instills confidence and trust. So a couple of tactical considerations that I did want to share as it relates to reopening. All of our clients have put their plans on their homepage about what their reopening plans are going to be, either that or a link to their plans. They're using social channels to keep their constituents up to date about what they're doing to reopen. They're using outgoing voicemail, very important for especially patients and customers. Email is critically important. All of our clients are issuing traditional press releases announcing aspects of their reopening process. And one thing that our partners in the life science industry do not take for granted is the fact that if they are reopening, they've survived. And sadly, some companies are not going to weather this storm. And it's an opportunity to express gratitude, which is in line with the life science industry values and core mission to serve. And I always encourage my clients to take the opportunity, not gratuitous, but to take an opportunity to humbly take a corporate social responsibility initiative as they're reopening to show their commitment. Maybe it's a donation to essential workers, maybe it's a donation of products and services, maybe it's a donation to patient groups. But if not, I think it's a missed opportunity for the corporation. And unfortunately, I do have this slide because, as PR professionals, we're always planning for the worst for our clients. As good communicators, we must. And so we've been hearing a lot about the possibility for a rebound of this pandemic or a second wave. And quite frankly, in the absence of a vaccine, or if it even exists, herd immunity doesn't happen, we'll see this pandemic come back and forth in waves, which might require us to go back to maybe a closure, maybe a quarantine, maybe a different way of operating, which means that we have to close again or prepare for this second wave. And you really kind of have to go back to the first plan. We need to remain positive in our tone. We need to instill trust and confidence. We can't delay if there's bad news about a rebound, about having to quarantine again. We have to be honest and consistent, and we have to continue to listen. And so that's kind of a short tutorial for crisis communications issues management and some of the best practices that we've been utilizing for our clients and for folks that ask us for counsel. And so at this time, I want to thank you all for listening, and I'm going to turn it back over. And I look forward to answering your questions. Thank you, Caitlin.
Thank you so much, John. That was fantastic. I appreciate you putting this together. I know being an expert in this space, you could have gone into, you could have spoken for hours on crisis communications. I heard so many great points throughout. Some of the things that stuck out to me that I just want to highlight before I go into some of the questions through the chat box. I heard you say the life science industry is resilient. Take action, listen, repeat. Setting the tone, communicating consistently and honestly with your employees and your customers is of the utmost importance. Develop a reopening plan. Create a reopen task force, which is super important, and establish a timeline and be flexible. So many awesome points. So some of the questions that have come through so far, and then I'll unmute. So you mentioned the crisis task force and reopening task force. Who should be involved in those teams?
Okay, great question. And it depends, because it depends on how big the company is, what geography it's located in, and what kind of resources you have internally. But best practice, it's someone from the CEO's office, ideally the CEO. It's usually the head of public relations or public affairs. Alternatively, you might have someone from investor relations, but someone who represents the communications department of the company. A really good multidisciplinary crisis communication task force also includes someone from human resources, legal, and occasionally we'll have individuals drift in and out from other functions, but those are the core.
Great. And a follow-up question to that, the reopening team and the crisis team, are they the same? Should they have the same participants on both teams?
Yes, and I would say that their roles will change a bit. I think for reopening, the head of operations will probably find himself more involved with the task force because folks that are involved in operations and human resources are going to be the ones that are going to be experts on what is going to need to change, in the physical plant, in the office, in the R&D facility, in the manufacturing facility, and what actions need to be taken by even sales reps in their cars as they go in and out of customer offices. And the HR folks are going to be vital in that. And but the CEO communicating, the PR folks helping to craft the message. These are the vital players that are going to feed then, the key constituents with the messages. But I think that also legal in the reopening task force will probably have a heavy hand in saying, hey, don't do that, there's risk, or it's better if we consider doing something this way versus that way. So good legal counsel, I think, is going to also take a much higher level in a reopening task force.
Great. And you mentioned consistently communicating. How often should they be communicating with their employees, with their clients about the reopening plans?
Good question, and it's a hard one to answer because there is a tendency to over communicate sometimes. And if I look around at who's doing things the best, and I'm based in New Jersey, so but JFK Communications has clients all over the world, but I've watched other companies who are doing it right, and I look at companies like, I'm throwing out examples like GenMab, if you look at how they're doing it, or Insmed or Sanofi, I think they're keeping it simple. They're not taking up the task of helping everybody understand what the virus is. They're mostly focusing on how it affects the employee and the customer and potentially the partner. So I think keeping it simple and communicating when necessary. For example, if you have a timeline for reopening and a regulation comes out that's going to impact the timeline, you have to announce that there's going to be a change in the timeline. If you have a reopening plan that is going to cadence groups, waves of employees, say 2 weeks on, 2 weeks off, and you have to change that from 3 weeks on, 3 weeks off, and I'm making this up, that's a time to communicate. And we've watched and we've counseled our clients on that cadence of communication, and we have found that having a portal on your homepage, on your website, that keeps everybody up to date on where everybody is exactly in the reopening process is best practice. And if you keep that up to date, and every time there's a change, posting it to your different channels, and social media is a huge channel that you should employ for this. I see a lot of organizations who fail to utilize social media in this. It's very efficient, very effective, very credible. But I would say limit the number of communications to those that are necessary, and don't find the need to or find excuses to over communicate.
Great. I heard you mention social media a few times throughout the presentation just now, so this is a social media question. How can companies navigate through negative social media posts, especially by employees?
Well, most of the companies that I work for, I encourage them to have a social media policy, and there should be a policy in place where employees cannot post about the corporation. Hard to enforce, just a policy, but all communications should be negative or positive. There should be a response. And sometimes if it's a critical post, it will require the task force to determine whether it requires a response. And I'm kind of the mind that especially negative comments should be addressed, especially if they're true. I talked about the best defense is a good offense, and being out in front of bad news. A lot of organizations that I've worked with, who shall remain nameless, will want to delay. It's natural to want to delay bad news. But a lot of times, like there was, I've seen some mistakes made where even healthcare institutions didn't have proper PPE, and their employees started to post about the fact that, hey, I'm working in the front line and I'm not even getting proper PPE. And that is a time where you really need to immediately and truthfully get out in front of that kind of a negative post. And because it's an employee, you can communicate directly to that employee. And the one thing that you cannot do is you cannot make the employee, you can't sanction them. Then it just makes the problem worse.
Right. Right. Now, you work with companies nationwide, obviously internationally. What are some of the PR mistakes that you've seen companies make as they reopen?
Oh, wow. Where do I begin? It's why I'm in business. And it's natural. And like I said, when we're looking back on 2020 and 2021, I think a lot of, especially even the best CEOs, are going to be forgiven for any missteps. Be that as it may, I've seen a lot of companies on the firing line wait. So, delay is probably the biggest sin that I've seen committed during this pandemic. I've seen it done, and sticking to the life science community, not necessarily among industry, but among I'd say government healthcare organizations have suffered from analysis paralysis. There's been some missteps, I would say, in over reassuring. We should not do that, especially with this crisis, with this pandemic. I think it's folly to over reassure anybody. I've watched companies shamelessly over market versus and because of the virus. As a PR professional, I find that repugnant. And then garden variety mistakes like not having information on an outgoing voicemail, especially that's designed for patients or customers, big sin. The platitude communication, meaning a proclamation that a company is going to do this, and then 2 weeks later you find they haven't done any of it. Non-disclosure has been an issue. I've seen some companies take some dings for non-disclosure. I'm sure other people could come up with some other mistakes, but those are the ones that come right off the top of my head.
Great, thank you. Now, as the reopening teams and the crisis team that are in place, should they be anticipating a second wave of COVID-19? And should they be planning to alleviate some of the pain felt when this first started?
Yes and no. Yes, they should be anticipating and planning for a second wave. And no, we shouldn't over reassure that we can make anybody comfortable. It's an unfortunate truth, but the truth is, this world, the life science industry included, is going to have to walk through this and feel the pain. There's really not. We can be honest and truthful about what we're going to do, but I don't think it's going to make people feel better. I think it might. The alternative of being silent or lying, being honest, truthful, and upfront and rapid and positive in tone, you doing all the crisis communication best practices. If there's a resurgence and a rebound of this pandemic, like we saw earlier in March and April, it's going to be tough to make people feel better, but we can do our best.
Right. Well, those were all the questions that I received. So I'm going to unmute everyone on the line here. So if anybody wants to have any questions or comments, feel free to jump in. All right, I think nobody has any questions, additional questions. John, I cannot thank you enough for putting this together. This was so great, very informative. And everybody on the line, thank you so much for joining. We appreciate it. Have a wonderful day.
I'd just like to say, Caitlin, in closing, if folks do have questions that they had and didn't ask, or that they thought of later, please feel free to reach out and ask. I'm happy to answer any questions by email.
Fantastic. Thank you so much, John.
You're welcome. Thank you for having me again, and thank you, everybody.
Have a great day, everyone.